My name is Mulenga Kampamba. I'm the Quality Improvement Manager for Western Province under ICAP. With me, I'm going to take you through the integrated QI methodology, QI project that was undertaken in Western Province for PrEP to increase the coverage. With my team, I've got the Lieutenant Colonel Lupabowa, Pascal Sikuka, our M&D officer, Sipiwe Kasonga, our senior advisor for QI, Dr. Job Mwanza, our technical director, Mr. Stewart, Dr. Mtiti, Sambo Luvasi, and our CD, Dr. Priscilla Kasonde. So the background to our project, we are saying that ICAP provides technical assistance in strengthening HIV and TB services, of which PrEP is one of the services. And we realize that PrEP is a highly recommended HIV preventive strategy to people that are very much at high risk of acquiring HIV infection. And to that effect, we realized that in October 2020, the baseline data for people who were accessing PrEP services was at 13% in the 18 sampled high volume health facilities. So due to this low coverage, in collaboration with the Western Provincial Health Office, ICAP embarked on a QI project. And in this QI project, our aim was to increase the coverage for PrEP services in the 18 identified health facilities, which are high volume, from 13% to 95% by end of September 2021. The method that we had used in implementing our project, we had conducted a root cause analysis using the fishbone technique as one of the methodologies in the quality improvement. So the root causes that were identified were as follows. The first thing that we realized was that PrEP was only provided at the ART clinics in most of the facilities, because other facilities, other departments were not aware of what PrEP was actually. There was also inadequate skills by the healthcare providers on the provision of PrEP services. Most of them said this is a new service, so they were not very familiar with how to go about it. The other root cause was that the stigma was associated to accessing PrEP drugs from the ART department, which is associated with HIV positive people. So people were not comfortable to go to the ART department, so they preferred to access services for PrEP from other departments. And more to that, we realized that communities did not actually know where these PrEP services were found at the health service, or didn't even know that PrEP services were available at the services. So the interventions that were put in place after realizing the causes to the problem were as follows. We had to orient the facility staff on the provision of PrEP services because most of them did not have the knowledge on services for PrEP. Then we had to appoint the PrEP champions for sharing the terms of references. These PrEP champions actually had to spearhead PrEP services in the various facilities where they are working from. We also initiated PrEP screening in all facility entry points, especially at OPD. This enabled us at least to promote more access to PrEP services other than just concentrating on the ART clinic. There was also fast tracking of PrEP clients to avoid delays in offering PrEP services. So clients who just came for PrEP services could not be subjected to be queuing in queues for ART services. They had to be given that privilege where they could be seen other than going to the PrEP to the ART clinic. Then dispensing PrEP drugs by clinicians instead of sending clients to ART clinic. So the clinicians were oriented on how to provide PrEP services just within their screening rooms instead of sending clients to the ART clinic. Then mentorship was done to the healthcare workers on the management of PrEP commodities, especially the recommended PrEP drugs. This helped in preventing stockouts and they had to have all the required PrEP drugs that they had during the provision of the services. After implementing the interventions, the results were realized as follows. Our baseline in October was at 13%, where we had only 550 clients. And after implementing the interventions that I had highlighted before, and some of them which could include like the screening of PrEP clients in all departments, orienting of staff in PrEP services, dispensing of PrEP drugs in OPD by clinicians, and also providing the mentorship to the health facility providers so that they could be competent in the provision of the services, and also providing information and education to clients in the schools and the community at large, and even the gatekeepers, so that they could help us sensitize on the importance of the provision of PrEP services. So with all these interventions that we had put on, we realized that we had met our target, which we had targeted at 4,078, and we managed to have 114% at the end of September 2021. In conclusion, we are saying that integrating quality improvement methodologies in improving HIV/TB care and prevention, HIV and care prevention services such as PrEP has shown to be essential in improving uptake of PrEP services, as shown from the collaborative project, and can contribute to the province and the country at large in attaining the HIV epidemic control, which we are working on as a nation. Having implemented our project so successfully, we give the following recommendations. We are saying that the PrEP services should be provided by clinicians in other departments and not restricted to ART department. This will help more facility clients to access the services and decongest the ART clinic. We also recommended that facilities should be fast tracking PrEP clients to reduce on time spent at the clinic, at the ART clinic. This will also minimize those who are having who are not comfortable to go to the ART clinic to access the services, because they won't go to the ART clinic, but they will be given ART PrEP services from somewhere else. We also recommend that PrEP should be provided in health posts, which should be integrated during the outreach programs. This will help us to increase on the coverage, and also accessing those people who cannot manage to walk long distances to various facilities in the communities. As we know, people are living in distant places. PrEP commodity also should be well managed, so as we avoid the issues of stockouts, and because that would discourage clients from accessing the services, because once we start them, then they would complain to say we've started things that we cannot manage to sustain. And finally, we are saying that orientation of staff working in the ART clinic in QI methodologies should be rolled out to all high volume facilities for a QI impact on the HIV cascade. This is very important, because when staff appreciate the QI methodologies, they are going to utilize them and even use them in other services that need service improvement delivered. And if every facility staff has got these QI techniques and skills with them, they are going to provide quality healthcare services to the community at large. Thank you so much.